This test requires about 2 mLs of serum. I'm going to go ahead and pull full 3 cc's of blood. I'm going to go back there. I'm going to go ahead and take my tube. Go ahead and insert. I'm going to let it go ahead and go into on its own since it is a Vacutainer tube. That way it decreases hemolysis. And then we're going to let it sit for about 10 minutes to clot, and then we'll spin it. I'm also going to go ahead and label this with our name and our account number and the date. It's clotted. I'm going to go ahead and I'm going to put it in the centrifuge. I've already got a balance in here that's equal to this tube here. So I'm going to go ahead and set it in there, and then I'm going to get a timer and set it for 10 minutes. Go ahead and start it. Start the centrifuge, and then we'll wait for the timer to go off, and then we'll stop it. Now that our timer has gone off, I'm going to go ahead and use some tweezers to pull it out of the centrifuge. And then we'll go ahead and we'll place it in a labeled bag. I've already got the bag prepared. It's got the requisition in it. And we'll go ahead and place the sample in the bag, making sure that the name matches what's on the requisition. And then we're going to take it and we will put it in the refrigerator until the lab comes to pick it up later this afternoon. I'll go ahead and get a sample ready, biopsy sample ready to send out to the lab. We're going to make sure we have adequate paper towels. I'm going to take and wrap around the sample. The sample is labeled, it's got all the information on it, where it came from, patient that it's going to. We want to make sure that it matches the requisition that we have over here, which it does. So we're going to go ahead and take this, wrap it in plenty of paper towels and stick it inside a baggie just in case there's any spilling. I'm going to make sure that it gets absorbed. It is sitting in formalin, so make sure we get the bag up really well. We're going to stick it in the box. I'm going to put a couple extra paper towels in there just for stableness. And then we're also going to get an ice pack. We're going to do the same thing, wrap it in some paper towels. Put it in a bag. This way, this is nice and cool. Sit that in there. Make sure our requisition goes in here. We'll go ahead and tape up the box. And I've already got my label printed out. So we're going to add that to the top here. We'll stick it in an envelope here in just a little bit, and then we'll send it off to the lab, and then we'll get the results in later. I'll demonstrate how to do some maintenance on the Snap Pro. I'm going to go ahead and we're going to turn it off. I've got it unplugged. We'll turn it over, unlock the bottom part here, lift it up. Basically what we're going to do is we're going to check back here. We're going to make sure that all this area is clean of blood. As you can see, there's some blood kind of caked up there from when the test snapped. Sometimes there's extra blood and conjugate in the well, so it kind of snaps up to the top. So we want to make sure that's all clean. Sometimes it can, if it builds up too much, it can drop down into the well, and then we can get contaminated tests and incorrect results. Make sure everything in here is just clean. We'll go ahead and turn that over. I'm going to look at this part here. I'm going to flip it over. Make sure that this area is also clean of blood. I'm just using some alcohol on some Q-tips to make sure everything is clean. Make sure everything functions well, nothing sticks. Everything moves pretty freely. Go ahead and stick this back in here. And put it back together. Again, make sure that it moves freely here. We don't want anything to be in the way. We want to make sure that everything is clean here. Some dust back here. We don't want that to get into any of the plug-in areas. We'll go ahead and clean this off. And then we want to make sure that the screen is clean as well. We don't want to mess up any of the calibration when it comes to pushing the buttons on there. We want to make sure that what we're touching is actually what's getting pushed, as opposed to maybe touching down here and actually hitting something up here. So it helps to keep the screen clean and keeps us from having to recalibrate the screen as often. So we'll let this turn back on. Make sure that the internet signal is good, and then we'll also make sure that the battery status is good. Since it's been plugged in, it should be fully charged, which it is. So we've got that up there. Green light. The screen is clear, so we don't have any pending heartworm tests or any combo tests at all, which is important to know. Sometimes it doesn't always get deleted in this machine, even if it gets put in the computer. So I want to make sure that that's clear, just to keep it from getting built up. And then that's about it. I'm going to go ahead and run this combo test. Snap on its own, and then the reading will come up on the screen. Regular heartworm test. The test came out. Control is there, and no other dots are present, so the test is negative. Here's on this kitty. He's scratching his right ear, so we're going to take this Q-tip here, and we're going to just kind of get that in there and get some debris on it. I've got some on there. What you got for free, honey? I'm gonna go ahead and we're gonna take it and we're gonna just roll it onto the slide. And then we're gonna take it and heat fix it real quick. Make sure it gets rolled on there really good. I'm going to go ahead and heat fix it with the lighter, just kind of a few quick rubs underneath. We're going to take a Kim wipe and just wipe off the blackened portion on the bottom. And take it and we're going to dip it in the dish quick stain. rinse it off in the water here. A little bit, so we'll go ahead and dry it off, and then we'll look at it under the microscope. Alright, it's nice and dry, so we're going to go ahead and take some oil. Just put a drop on there. And we'll go down to the immersion oil, the 100. Lens to make sure that we can get as close as we can. Right now, what I'm looking for is any bacteria or any yeast, bacteria being either cocci or rots. And right now, not really seeing either. We suspect that this kitty might have a food allergy. He doesn't have a whole lot of discharge in his ears, but he's just scratching at them. But I do see a little bit of cocci. So far, not seeing any yeast. Sometimes we'll see budding yeast. So far, I'm not seeing any of that. That's about all you look for on an ear slide. Okay, so we're about to do a necropsy on this kitty right here. We've gone ahead and gotten our wet table all set up. We've got our instruments kind of in a cold pack just so that we can use them as we need them. We've got a couple of pair of scissors, Mayo and Medicine Bombs, blade holder, needle driver for when we're done. Also got a few different sized containers of formalin, so that when we take our tissue samples, we can put them in there and put them in appropriately based on the size and the amount of formalin in the jar. Also has some suture. We've got some blades, and then these are for cutting through some bone so that we can get into the chest cavity. As far as personal protection, I have on a cap, and I also have on a mask. Also have a gown, and then I'm also gloved, so that and as is the doctor, she is also appropriately clothed, so that we can go ahead and do this necropsy, so that we are remaining safe at this point, just because we don't know much of the history on this cat. Okay, we're good.
Okay, so we have this kitty. Jessica's already shaved and has her prepared for the necropsy. This animal was actually obtained from our local shelter. So we don't. All we know is that she was a feral kitty, and just on gross inspection of her skin, we can see that her teats are engorged, and she does have some milk that is coming from them. So I suspect that she had a recent litter, or is currently pregnant. Just palpating and kind of feeling inside of her abdomen, her intestinal loops feel very thickened, very thickened and ropey. So we'll definitely want to pay attention to that when we get inside. Okay. You can actually see this kind of poking through right here, and that is actually lymph node, and then this right here is actually a piece of intestine that we can actually visibly see through her abdominal wall. That's how thick it is. Okay, So I'm going to ask Jessica to hand me a blade. With most necropsies, we tend to start in the chest cavity first. And of course, where and what we're looking for kind of depends on the history of an animal. If this animal had presented that, particularly with a cat, that the owner had just found that he she just passed away and they don't know why, we definitely would want to start with the chest to look for heartworms, which is a very common presentation in a cat that we just find suddenly death, or heart disease in general. So Jessica's getting me a blade together. Thank you. Start right over the top of the chest here. I'm just going to go ahead and extend my skin incision all the way down the abdomen. Of course, we've got to have a little bit of milk in our way there. Okay, and as you can see, we're actually down to the rib area. If you will hand me those bone covers, I'm going to just start by making a little stab incision to kind of get us started. I'm going to use these to just kind of cut through the ribs. Get through some of that muscle. I'm just going to kind of cut right along the sternum, where it's a little easier to get through them. So what we're going to do to start is just to kind of take a peek in there, and we can actually see the heart. The lungs, we want to look at them, visually inspect them, check their color. They actually appear normal for a post-mortem, very smooth. The heart is a normal size and shape. Ordinarily, if we were suspicious of anything with this cat as far as the heart is concerned, we would actually incise the inside, looking for evidence of heartworms, or more importantly, really to look at evidence of left ventricular hypertrophy in the case of hypertrophic cardiomyopathy, which is common in cats. And truthfully, with heartworm disease in cats, we probably would be paying more attention to the lungs to see if there were any changes there. We can actually see the diaphragm, this thin sheet here, and that all looks good. So we're going to go ahead and incise into the abdomen at this point. Based on what I'm feeling in her abdomen, I think we're going to find some things going on there potentially. I am going to incise back this way a little bit. So again, the first thing we're going to do is just kind of peek at everything in there and see how things are looking. Is there any evidence of fluid? We can see the liver here, which appears normal. And not only do we look at it as far as how it feels, but how it looks, but we also want to touch it and see how does it feel. Does it feel normal? Is it hard? But it's nice and smooth. We look down, we can definitely see that her kidney there. So right kidney, left kidney, and her reproductive tract, which actually looks fairly small. She may have been experiencing a pseudo pregnancy or false pregnancy. Intestinal loops definitely very, very thickened, and we'll go back and then take a look at the stomach and kind of feel the contents there. If this were an animal that the owner suspected some type of poisoning or toxin ingestion, we would definitely look at the liver. We'd probably open the stomach and check the contents. And then from that point, we just basically run the bowel and go the whole length of the bowel, looking for abnormalities along the way. The entire intestinal tract feels very thickened to me. This patient has been deceased for a few hours, so this may be a post-mortem finding. There. One thing that we'll say is, and here's her spleen. I was like, where is the spleen? It was kind of tucked under the stomach there. Very small, which is normal for a cat, and smooth, no lumps or bumps. The pancreas, which is running along the intestinal tract here. There are some little mottled areas inside of the pancreas, so that may be a good place for for us to take a sample. That could be a normal finding, but we'll submit that for histopathology in order to be able to tell. So what we're going to do is I'm actually going to take a piece of the tissue and then have Jessica place it in our formalin container. And I'm going to try to get a piece here that is representative with those little whitish dots there. And use my forceps to, okay. And then when we're done, we'll appropriately label that as pancreas. Pancreas. And now we're going to actually look, since these intestinal loops feel so thickened, we'll actually get a piece of small intestine here. Which might actually cause us to have some oozing, of course. And I'm actually going to open the lumen just to kind of take a look on the inside. Okay. And I'm going to actually use my forceps to drop it into the formalin. And I may just go take another piece of small intestine from further down. So there's the cecum just working back. We'll get a piece of ileum here, just to have a representative piece from a couple of areas within the intestinal tract. Urinary bladder looks fine. Kidneys appear healthy. And the gallbladder, kind of forgot to take a look at him when we were up there, but he's gallbladder's actually small, not full, no problems there. It does feel like there's a good bit of food in the stomach, but nothing hard or firm. Okay. So now we're just going to replace the abdominal contents, and we are going to close the defect before sending the kitty to be cremated.
As far as necropsies go, if we had been concerned about rabies, we would have wanted only vaccinated individuals to be working on the animal, as well as any personal protection we would have wanted to double up on, so double gloves, and then just dispose of any gowns, so wearing disposable gowns instead of washing them. Those are the precautions that we would have wanted to have taken if we had been suspicious of rabies. As far as testing for rabies in our particular county, the shelter prefers to cut the head off for send off for analysis, but we potentially could do that. The county here just prefers to go ahead and go ahead and cut it off themselves, since they are fully equipped, and everyone at the shelter there is vaccinated, so that they don't have to worry about the risks of contamination. I'm going to do a quick vaginal cytology on this girl right here. We're going to put a little bit of saline on this. This is a sterile cotton swab. I'm going to part the hair. We're going to kind of just go in. Just kind of very gently. We get all around in there. I'm going to come back out, and we're going to just roll. Again, roll very gently. Make sure we get this on the tip of the cotton swab as well. Then we'll let this dry. Once it dries, we'll go ahead and stain it, and we'll look at it under the microscope. So this is our vaginal smear, which has plenty of time to dry. We're not going to heat fix it. We're just going to go ahead and stain it in the clean stain. Do about 10 dips in each stain to fix it onto the slide. Here, and just gently rinse off the back end of it. We'll take a clean wipe and dry the back end of the tip. And then we'll let it air dry, and then we'll look at it under the microscope. Okay, now that the slide is dry, I'm going to go ahead and take a look. We're going to start with the 40 and see if we can find a grouping of cells. Here first, and then there we go. Let's see if I can find a good group of stain, which is right here. So what I'm going to do is I'm going to go ahead and I'm going to take a little bit of oil. Put a drop right in the center. Go ahead and take a look and see what we see. This was on a dog that's been spayed for a while, so should expect to see just really some epithelial cells, which is really all I'm seeing so far. a random yeast. Not even seeing a white blood cell. Some keratinocytes epithelial cells, and it's really about all I'm seeing. Which is perfectly normal for a spayed female dog. So it's normal that it's not too terribly exciting of a cytology. Alright, so I've got my two samples here, the recipient and the donor. So right now I'm waiting for the blood to clot so that I can spin the samples. Now that I've centrifuged the samples, I'm going to go ahead and I'm going to start with the donor, and I'm going to take the plasma. Put it into this tube here, just to have for later. Recipient's blood. I'm just going to stop it back on. Blood cells. I'm gonna go ahead and put the caps back on. Keep those over here for later. Throw these away. So the next step is going to be to wash the blood left in the EDTA tube. So I've got 2 more little pipettes that I'm going to use. I'm going to put them in disposable test tube. I've got them labeled. This is the recipient Nova here, and then I've got the donor Luna here. I'm going to go ahead and start with 1 to 2 drops of blood in here. Make sure the names match before I go ahead and do this. I'm going to go ahead and really take the top back off. Just take drop. Right. And we'll do an additional. Save the rest. Put the lids back on. And try and keep them on the same side of the rack so that we don't get them confused. I've got the 2 drops there. I'll do the same thing with the recipient's blood. to get either of these contaminated. From there. So I got the tubes with saline. I've already got some pulled up here. This one. I go ahead and centrifuge them for 1 minute. Primer, and then we'll wash off the top, the supernatant, and then we'll do it again. So we're going to pull those samples out. On this one because that was kind of mix them up. Alright, so I'm going to do the same thing again. Each one. I'm going to centrifuge them again for another minute. Okay, so this is the second time we've been centrifuged, so we'll go ahead and pull off supernatant. I'm going to fill that one back up again in just a minute. Get a new pipette and do the same thing. And this will be the last time that we wash them. So we're gonna wash number 3. Set them back in here for another minute. Okay, so we'll go ahead and take them out. And it's definitely colorless. There's no color to the super neat. It's very clear. So we'll go ahead and pipette out the super neatens on top, and then we'll have just the washed red blood cells on the bottom. Be careful not to disturb the red blood cells that are sitting on the bottom. And then I've got just some red blood cells sitting here. So put those there, and put them right there, and then I'm going to use this new tube. Pull out my other sample, which is the donor, and do the same thing. A little bit more in here. Okay. So now that I've got the red blood cells, I'm going to throw these away so they're in, or at all. I'm going to take new tubes and make sure that they match. Put my donor here. Here, we're going to take 0.02 mLs of the packed red blood cells. Point 2. This here. There. I've already measured out the 0.98 mLs of saline. I've already measured that out, so I'm going to go ahead and put that in there. Put the cap on there. Go ahead and do that to this one here. Got our 2 new samples here of washed red blood cells with the saline included. We're going to move on to our next step. So I've got 2 new labeled test tubes, and I've got my serum here, and I've got my washed red blood cells here. So I'm going to go ahead and in the first test tube, I'm going to place it right here, and I'm going to open, I've got written on there, I'm going to take 2 drops of the recipient serum. I'm going to make sure that that's exactly what I'm grabbing. Go ahead and pull the top off of that. And this should be the wash of the donor, which is correct. Take 2 drops of each, and we're going to put it into that first. Tube there. I'm going to take 2 drops of the serum. Place them in there. Place those there. Cap back on. And put the cap on here. I've got the recipient serum and the donor's cell washed in here. And I'm going to do kind of the opposite in this test tube here. Take 2 drops of the donor serum and then 2 drops of the recipient's cell wash, or wash red blood cells. I should put that there so I don't get them confused. And we're going to take this. 1, 2. Take 2 drops of the wash. It's here. Alright, these sitting here. Drop down to the bottom. Alright, and kind of switch them around to mix them a little bit. Okay, so we're going to go ahead and set up controls. I'm going to go ahead and do the donor's control first, which is this tube here. This is indeed the donor. Two drops. drops of the donor's red blood cells, which is indeed what this is. So this is our donor control. And then we are going to do our recipient's control. We're doing the same thing, only with the recipient's cells. Again, I'm checking to make sure that this is the recipient before I drop the cells in there. Okay, so I've got my controls here next to each other, and then I've also got my actual testing tubes over here. At this point, I'm going to take all of the tubes. I'm going to kind of gently shake them just to kind of mix them a little bit. And then I'm going to let them sit here at room temperature. For about 30 minutes. And then once we come back, we'll examine them for some hemolysis after we centrifuge them. So we're going to go ahead and centrifuge all 4 tubes that are in there for a minute. So looking at the controls, trying to get the, there's really no hemolysis. It's hard to get the camera to focus, but there's no hemolysis in this control, which is the recipient. And then in this control here for the donor again, it's really the reflection off the red blood cells that's making it look pink. So the test went well. And then as far as the hemolysis, this is the donor serum, and the recipient's cells. It does look like there is some agglutination in there. Again, I can't get the camera to focus very well. Then, so theoretically, we should see the same thing in the other tube after kind of mixing it up a little bit with your finger. There's definitely some agglutination there, and they're kind of clustered around. So because of the agglutination that is in here, it is pretty significant. They would not be compatible as far as donor recipient, and we would need to select a different donor to see if it would be compatible. Alright, we're going to go ahead and do a skin scraping on this dog. I'm going to go ahead and just shave a little area right here, just so I can get a clean scraping without a whole bunch of hair included. You can take these and kind of shave the little spot. And then I don't want to take anything and clean the area, because then I may be getting rid of some type of organism that I need to be catching. So I'm going to go ahead and I'm going to take my, I have a slide here, it's a mineral oil. I'm going to take my blade and I'm just going to kind of dab it in there just a little bit. And I'm going to take this and I'm going to go kind of in a perpendicular fashion to the skin. And I'm going to kind of just scrape. Careful not to make an actual incision. And since you're just looking for mites, I'm just going to scrape until I see some of the capillary beds kind of appear. And I'm starting to see some. I got a good sample just like that. I'm going to go ahead and take it on this slide. And I'm going to go ahead and get it on there. And go ahead and kind of spread it out a little bit so there's not huge chunks to look at. That way it is prepared to look at it under the microscope, and what we'll do is we'll look for any mites or any organisms that should not be there, including mange, which could be both Demodex or Sarcoptic mange. I guess we're going to go ahead and evaluate our skin scraping. I'm going to start on our lens. Just going to take a look around and see. Demodex is going to be kind of almost tick looking, and then the Sarcoptic mange is almost tick looking. The Demodex is almost a caterpillar type thing. At this power, we're not gonna really see a good evaluation of yeast and bacteria. We'll go up one more here in just a minute. Right now, I'm just seeing blood cells and kind of some clumps of hair. Nothing else of significance. 40 lens. Again, there's going to be a normal flora of bacteria and yeast, but if we were to see an overwhelming amount, then that would indicate that we would have a problem, some type of infection that we would need to address. But other than that, the skin scraping appears perfectly normal, and the dog is not symptomatic, not really itchy or anything. So we'll go ahead and just continue. There's no treatment needed, so that's about it. Take this off. We'll make sure, just in case any oil got on the microscope, we'll go ahead and clean this. I'm going to make sure that I go ahead and wipe the lens as well with the Kim wipe, just to make sure.